Today is Wellness Wednesday, and this morning we are talking about restoring functional ability and quality of life to people with physical impairments and disabilities. Joining us today in this sponsored segment is Dr. Azuh. He's a physical medicine and rehabilitation specialist at Memorial Healthcare Center for Orthopedics. Good morning to you.
Good morning.
Yeah, thank you for coming in. Let's talk about what you do. What does a physical medicine and rehabilitation specialist do exactly?
So, good question. I'm a medical doctor who went to medical school, completed medical school training, and decided to do physical medicine and rehabilitation residency. So part of our job is that we wear a variety of different hats, and we see patients from multiple different specialties with the goal of helping to improve their function and their quality of life.
Yeah, and why are you so passionate about that? Why do you enjoy what you do?
I love what I do because I'm able to see a patient who comes in. They may not know where their pain is coming from. I'm able to utilize my physical examination skills and figure out where their pain generator is or where the issue is, and then create an appropriate treatment program and send them on their way and hopefully to get better.
Yeah, so when you hear about people going through something physical pain-wise, talk about this. How is physical medicine and rehabilitation different from physical therapy?
Good question. So we are physicians, and our goal is to try to figure out and narrow down where the issue is coming from. So once we're able to find that, utilizing physical examination skills in our medical training, we're able to create a tailored physical therapy plan and program and to send to the physical therapist. And we're also able to monitor their progress and see if there's any functional barriers, and if there are any issues there, we can intervene medically.
Yeah, it sounds like there's some challenges involved there, but it sounds like you're up to that challenge.
Definitely, definitely.
Why is that?
Because I'm very passionate about what I do. To see someone who has a decrease in their quality of life, whether they've had a stroke, traumatic brain injury, spinal cord injury, multiple sclerosis, and maybe they may not be able to walk. So, but after evaluating them, we see, okay, this is where we need to tweak, this is where we need to fix, this is where we need to focus our energy, and then have them improve. It means the world to me.
Yeah, like you said, it's all about improving their quality of life. So with all that said, what are some of the ways that you treat your patients with physical impairments or disabilities?
So take, for example, a patient. Actually, I'll start with what is the goal of treatment.
There you go.
So I talk to a patient, say they have multiple sclerosis, and their issue is they're having difficulty walking. So from evaluating them, I realize that they have weakness in their legs, their foot is dragging, and their leg is stiff. So what we do is we send them into physical therapy to work on strengthening of the lower extremity. We may order a ankle foot orthosis or an ankle brace to help lift their foot up when they're walking. And sometimes we may put Botox in their extremities so they're able to improve their range of motion and their function.
Yeah, so bottom line, it sounds like you take a multi-pronged approach when it comes to finding out the best treatment.
Definitely, definitely.
So for more information, you can visit memorialhealthcare.org, or you can call the number 989, that is 720-CARE or 2273. Again, that's 989-720-CARE 2273. Thank you so much for coming in today and filling us in on what you do.
Thank you very much for having me.
We appreciate it.